Hi everyone. Today we are going to begin Unit 2 and we are going to be looking at the treatment of psychological disorders for the next couple weeks. Psychological treatments, how many types are there? Quite a few actually, and for your assignments with your infographics you looked at three. Insight therapies, behavior therapies, and biomedical therapies. But we're going to start with insight therapies. This is also known as talk therapy, talking through your problems. Clients engage in complex, lengthy verbal interactions with the goal being to pursue increased insight regarding the nature of the client's difficulties to sort through possible solutions. So bottom line, you look at what needs to be fixed per se, and you talk through it, and then you work through a possible solution to the issue. Behavior therapies. Behavior therapies are based on principles of learning, and therapists make direct efforts to alter problematic responses, phobias, and maladaptive habits. So your therapist would try to look at how they could change or alter your behavior so that you no longer experience the symptoms of phobias and or maladaptive habits. Biomedical therapies involve interventions into a person's biological functioning. Sometimes this occurs when patients receive drug therapy or even treatments such as electroconvulsive shock therapy. And we'll talk a little bit more about that as the unit progresses. So who seeks therapy? Not necessarily who needs therapy, but who seeks therapy. So according to the Surgeon General's report on mental health, about 15% of the U.S. population use a mental health service in a given year. This could be a variety of problems such as anxiety, depression, unsatisfactory interpersonal relations, even though I think we all experience that from time to time, right? We are unhappy with our friends, sometimes many times throughout the day. Troublesome habits, poor self-control, low self-esteem, marital conflicts. I don't think any of you are married, so you may not experience that. Self-doubt, a sense of emptiness, and feelings of personal stagnation. So for any of these situations, a client may seek therapy. People often delay treatment. Many years could pass by before a client may finally seek treatment for their psychological problem. The median delay for treating a bipolar disorder is 6 years. So what that means is the average person who suffers from bipolar disorder, it takes them 6 years sometimes to seek treatment for their disorder, okay? People vary considerably in their willingness to seek psychotherapy. That makes sense to me because a lot of times we don't want to admit or acknowledge that perhaps we're struggling to the point of needing help. Treatment is more likely when people have medical insurance or perhaps when they have a higher education. Sadly, many people who need therapy don't receive it. Therapy can be expensive, and if it is a service that is not covered under your health insurance, you may not have enough money to pay for it, and then you may, try to self-treat or ignore the problem altogether. Who should provide professional treatment? You can look at, friends and relatives. They may, provide excellent advice about your personal problems, but I want you to keep in mind that their assistance does not qualify as therapy. We all have a friend that if something is bothering us, we tend to go to that friend first. Sometimes it feels good to get things off of our chest, to confess, something that is bothering us. But friends are not therapists. Psychologists, first being clinical, their training emphasizes the treatment of a full-fledged disorder. Okay, a clinical psychologist would look at treating bipolar disorder or OCD. There is also a classification counseling, and their expertise is slanted towards the treatment of everyday adjustment problems in normal people. Psychiatrists are physicians who specialize in the diagnosis and treatment of psychological disorders. They devote more time to relatively severe disorders such as schizophrenia, mood disorders, and perhaps they would spend less time looking at everyday problems like a marriage issue, family problems, or problems that somebody might be experiencing at work. Other mental health professionals, psychiatric social workers, and psychiatric nurses. Counselors also provide therapeutic services, often specialize in particular types of problems such as vocational counseling, marriage counseling, rehabilitation, and drug counseling. Something that my husband experiences a lot in regards to his job. He is a chief of police of Swansea, Illinois. If a police officer, might handle a serious crime that may be upsetting, many times they will call in people for those law enforcement officers to talk to, sometimes even chaplains. So just something to to think about. So that concludes the first section of Unit 2 notes. If you have any questions about any of the upcoming assignments, please let me know. Send me an email, or you can stop by and see me sometime. That would be great too. Other than that, have a good week, and I'll talk to you next week.